In 2019, diabetes affected 37.3 million Americans, or 11.3% of the population. Type 1 diabetes affects almost 1.9 million Americans, including 244,000 children and adolescents. Of the 37.3 million people diagnosed with diabetes, 28.7 million were diagnosed and 8.5 million were not diagnosed. The proportion of senior citizens living with diabetes in the United States remains high at 29.2%, or 15.9 million individuals. Each year, 1,400,000 Americans are diagnosed with diabetes. In 2019, 96 million Americans aged 18 and older were diagnosed with pre-diabetes. In 2019, diabetes was listed as the cause of death on 282,801 death certificates. Scared yet? There is a way to stop diabetes in its tracks. Looking out for signs of pre-diabetes can significantly reduce the odds stacked against you. Pre-diabetes is the precursor to full-fledged diabetes. According to statistics, 1/4 of all Americans are in this pre-diabetic stage. Those affected will see a considerable rise in their blood glucose levels. Most pre-diabetic individuals will eventually develop diabetes. But dietary and exercise modifications, together with medication, may avoid this. Here are 9 signs that you may already have pre-diabetes. Before we do, please remember to like and subscribe. Okay, let's get going. Number 9. Higher blood sugar levels than normal. A pre-diabetic individual will have higher than usual blood sugar level. According to the American Diabetes Association, they range from 100 to 125 milligrams per deciliter on average. According to some experts, blood glucose levels below 100 milligrams per deciliter may also indicate pre-diabetes. The probability of acquiring diabetes is affected by both hereditary factors and body mass index. Therefore, people who are overweight and those with a family history of diabetes should consider frequent testing. Number 8. Wounds heal slowly. When a person gets a cut or a wound, their body has a natural ability to mend itself and generate new skin. But a person who is at risk for developing diabetes may not notice that wounds and cuts do not heal as rapidly as they used to when they were healthy. Peripheral neuropathy arises when the nerves fail to function effectively due to injury or destruction. This disturbs the regular functioning of the nerves. They may give pain signals when nothing is causing discomfort, or they may not send a pain signal even though you are being harmed. Consistently elevated blood glucose levels may potentially lead to peripheral neuropathy. Over time, nerves and blood vessels are harmed. This might result in the loss of feeling in the afflicted regions. Neuropathy is most prevalent in the hands and feet. When this occurs, you may not feel wounds when they occur. This is a primary reason people with diabetes tend to have more foot sores. This is more prevalent in diabetes than in pre-diabetes, although pre-diabetics may also have slower wound healing as well. Number 7. Mood swings. Maintaining appropriate glucose levels in the body is important for both mental and physical health. The use of refined carbohydrates is linked to erratic mood swings. If you have a meal that is high in sugar and refined carbohydrates, your blood sugar level will fluctuate wildly, which will cause you to feel exhausted, nervous, and angry, as well as hungry for sugars that are absorbed more rapidly. People who have diabetes are at a greater risk of experiencing these shifts in mood. People may feel that managing their disease is difficult and emotionally taxing, since it often includes making modifications to their lifestyle as well as taking on more obligations. According to the available data, those who have diabetes are 2 to 3 times more likely to suffer from depression. Depression is a common complication of diabetes. However, it is hard to recognize and diagnose. Because of this, it is strongly recommended that individuals have tests for their mental health and their routine checkups at the doctor's office. However, mood swings are a typical sign of a wide variety of diseases. One example of this is a natural response to changes in one's life. Therefore, it is possible that this symptom may go unnoticed, and it does not necessarily suggest pre-diabetes unless it is seen in combination with other symptoms that are connected to the condition. Number 6. Vision problems. According to studies, little under 8% of patients acquire diabetic retinopathy during the pre-diabetic period, which is before they have been given a formal diagnosis of diabetes. There are several symptoms associated with prediabetes, but two of the most noticeable are impaired night vision and blurred vision. If you are experiencing changes in your eyesight, you should have your blood sugar levels checked as soon as possible. Many people who have prediabetes are already showing the symptoms of full-blown diabetes. Number 5. Chronic fatigue. People who experience exhaustion on a constant basis could perceive this to be normal, particularly if they lead active lifestyles. On the other hand, the fatigue that comes with a pre-diabetic state is quite unique. People who keep themselves active inevitably find themselves becoming increasingly exhausted. On the other hand, a person who is pre-diabetic will feel weary even when they have not exerted themselves physically and will continue to feel exhausted even after getting enough rest. Those who are at risk for diabetic complications may notice that they are more fatigued after meals. Although this is associated with prediabetes, it is possible for this symptom to be caused by other health issues as well. Number 4. Sudden weight gain. Gaining unexplained weight while maintaining the same eating habits is one of the most prevalent signs of diabetes. A further possibility is that increased physical activity will not contribute in any way to weight reduction. Insulin is a hormone that is secreted by the pancreas. Its primary function is to control levels of blood sugar, which may then be transformed into usable energy. Maintaining a healthy blood sugar level might make it more difficult to lose weight, which is the one factor that has been shown to be effective in treating prediabetes. Because insulin-resistant cells have a challenging time extracting glucose from your blood sugar levels tend to rise. Insulin resistance makes you hungrier, which leads to increased food consumption. When there is an abundance of glucose in the blood, the pancreas receives a signal to produce more insulin. However, increased insulin levels stimulate the body to store the sugar as fat, and this is how the cycle goes on. According to research, pre-diabetic individuals who have a penchant for nighttime activities, go to bed late, and do not get adequate sleep are more likely to put on weight. Even a little amount of weight loss, between 5 and 10% of total body weight, may drastically lower blood sugar levels. Number 3. Excessive urination. Diabetes is a disorder that, among other symptoms, causes your body to have difficulty producing or using insulin. Insulin is a hormone that encourages glucose or sugar to enter cells so that it may be metabolized and used as a source of energy. This may lead to significantly raised amounts of sugar in the blood. When there is an excessive amount of sugar in the blood, it places a significant strain on the kidneys as their job is to process the sugar. When the kidneys are unable to perform their function, a significant amount of the glucose in the body is flushed out with the urine. This process also flushes vital hydrating fluids out of your body, which may leave individuals with diabetes feeling thirsty as well as causing them to urinate more often than normal. In the beginning stages, it is possible that you will not even be aware that you are urinating more often than usual. However, one of the most important warning signs is if the need to urinate begins to disrupt your sleep and reduces the amount of energy you have available. Because the evacuation of bodily fluids is often your body's sole means of flushing excess blood sugar, frequent urination is a defining indication of both type 1 and type 2 diabetes. Number 2. Digestive problems. The unpleasant sensations of nausea and vomiting are something that most people will experience at some time in their lives. However, for many diabetics, nausea and vomiting are symptoms they live with daily because of the disease known as diabetic gastroparesis. Both type 1 and type 2 diabetes have been linked to the development of a problem known as gastroparesis, which is another name for delayed stomach emptying, which relates to high blood glucose levels, often causes nerve damage throughout the body. The vagus nerve is responsible for regulating the passage of food from the stomach into the small intestine. When it is injured, food cannot pass through the digestive system as fast because the muscles in the stomach either do not operate effectively or stop working entirely. This slows the movement of the food through the digestive system. When undigested food stays in the stomach for an extended period, it may cause a range of health issues, including the proliferation of bacteria and the formation of mass in the form of hardened, solid masses. It is estimated that up to 50% of all persons who live with diabetes will acquire some form of gastroparesis at some point in their lifetime. However, the symptoms may vary widely from one person to the next. The following are among the most often reported signs and symptoms of diabetic gastroparesis: nausea after eating food, vomiting after eating, a feeling of fullness after consuming just a little quantity of food, bloating, a painful sensation in the upper part of your stomach, no appetite, heartburn, and a decrease in weight for no apparent reason. Number 1. Kidney disease. According to a recently published study, individuals who have prediabetes often have chronic kidney disease, CKD, that goes undiagnosed. In this extensive investigation, it was observed that more than 1/3 of the people who had prediabetes also had two indicators of kidney disease: albuminuria, which refers to the presence of protein in the urine, and a decreased estimated glomerular filtration rate. The eGFR is a measurement that defines the stage of renal disease and its measurement on how well the kidneys function. The stage of chronic kidney disease was exactly as advanced in those with prediabetes as it was in those with diabetes, the study stated. It was shown that a substantial number of people with prediabetes or diabetes also had stage 3 or stage 4 chronic renal disease. The progression of chronic kidney disease may be broken down into 5 phases. When the condition reaches stage 5, the individual will need kidney replacement treatment, which may take the form of either dialysis or a transplant. So, you think you may have prediabetes? Get tested by a healthcare professional and start changing your habits. Here are some bonus tips on how to avoid getting this horrible disease. Reduce the amount of added sugar as well as sugar alternatives. Eat meals that are not processed or refined. Ensure that you are getting enough of the necessary nutrients, including dietary fiber, omega-3 fatty acids, especially ALA alpha-lipoic acid, berberine, magnesium, zinc, chromium, and vitamin D3. Get regular exercise. A simple 30-minute walk every day does wonders. Make sure you get enough quality sleep. Develop healthy sleep patterns. Take control of your stress and maintain a healthy balance of your hormones, including insulin. Measure your progress. You can beat it before it starts. Please watch these videos for more content. Please like and subscribe, and thanks for watching.